Well, greetings, everyone, and welcome to a truly special online event today. It's called How to Use Medical Intuition to Evaluate Treatment Options. Apply clairsentient scanning to trust your body's wisdom alongside medical science. My name is Stephen Dinan. I'm the founder and CEO of the Shift Network, and I'm really blessed to be with you here, getting to learn from a true master of medical intuition. Her name is Dr. Jennifer Lisa Vest. She's an Afro-Indigenous medical intuitive. She's a healer and author. She's taught a number of programs for Shift, always to rave reviews. And she really is at the forefront of how we can understand the application of our deeper intuitive abilities to our health and well-being, and going into other layers that past life and other transpersonal dimensions of disease or medical challenges as well. So we're really blessed. And if you're excited by today, we have a brand new program launching with Dr. Vest. It's called Integrative Medical Intuition for Accelerated Healing, and we'll share more about that towards the end of the hour. So with that said, Dr. Vest, thank you so much for coming back.
Oh, thank you so much for having me.
Great. Well, let's dive in. And I know you've got a lot that you want to cover just on the teaching level, but it'd be great to have a little bit of the personal backstory behind your journey into medical intuition and how to really sort of approach it in a more integrative way.
Well, I came to medical intuition on a really windy route. I was born with a whole lot of gifts. I was a medium as a child. I used to see the future. I used to tune into other people's feelings, which is clairsentience. And I came from a long line of people with gifts, but I was trying to be on the intellectual path. I was in school, I was getting lots of degrees. I became a professor, and I was trying to kind of keep that side of my life a little bit quiet. I had two different lives. I was a professor by day, a psychic by night. And at a certain point, I realized I had to step fully onto my healing path. And part of that realization came from me having my own healing journey and going to a medical intuitive and having that medical intuitive tell me that if I didn't fully embrace my gifts, I wouldn't get better. And then that led me to lots of other teachers who really pushed me in the direction of medical intuition, because in the classes I was taking, whether it was psychic development or Reiki or healing or mediumship or trance work, what just kept coming up for me was I kept tuning into like my practice clients in class and getting medical information. And my teacher said, no one else is getting this. Like, this isn't a common gift. And it was the case in my classes that none of my classmates were picking this kind of stuff up. And so they really kind of pushed me and said, you have this unique gift, you really should develop it. And it was difficult back then to develop it. There weren't a lot of teachers, there weren't classes, there weren't books out. And so I had to kind of just find different teachers that I could work with, and then create my own medical intuition practice circle in my living room, where I just invited all my teachers and like people who had an interest in this, people who were healers and nurses. And we just started practicing and doing medical intuition scans on friends of friends remotely with just a name. And over time, that turned into me leaving behind my academic life, hanging a shingle, becoming a medical intuitive, developing other gifts to assist with that, like reading the Akashic records. And then I began to teach what I was doing, because my students kept saying, hey, we want to learn medical intuition from you. I was teaching psychic development and healing, and they said, but we want to learn medical intuition. And so I began teaching that. And I didn't really know at first if it was possible, because like I said, I didn't have a teacher who taught me this modality. I had to, with the assistance of my spirit teachers and combining all of the teachings from different modalities, I had to come up with my method. And my guide said, you just have to systematize what you do. And so I systematized what I did into what I call the VEST protocol for medical intuition. And then I just started teaching that, not knowing if that would work. But it seems to have worked. My students have been able to develop medical intuition and to go out and help other people. And that's been really exciting. And, more recently, over the years, as I've taught medical intuition more and more, I've become more and more interested in how can we combine medical intuition with other forms of medicine, because it's not, people come to us a lot of times because they've gone to their regular mainstream healthcare providers and they haven't gotten the answers. But of course, they can't just come to us and be done. They have to come to us and then they have to go back to their healthcare provider for follow-up, for diagnostics, for treatment. And so I wanted to figure out how can I help medical intuitives better work with other types of modalities like Western medicine, acupuncture, Ayurvedic. And so that's something that I'm really, really passionate about right now. And that's why I wanted to, develop this newest course.
Mm. Well, I think that that interface between different healing modalities and medical intuition is so important because in a way, medical intuition becomes like your GPS for how to navigate all these different healing approaches. We have abundance of them now, both Western and traditional. And so maybe share a little bit about how that you can kind of almost develop this sense of like how to cherry pick the best of different approaches and systems.
Well, what I've done as a medical intuitive over the years is I just kept educating myself about other modalities, about diagnostics, about treatments. And that was just really out of need because people would come to me and I would be tuning in intuitively and I would pick up a treatment. I would hear it maybe clairaudiently, or I would see it. And I didn't know what it was. I would just like hear something like, red light therapy. And I'm like, I have no idea what that is. And so I had to start like, educating myself. What is red light therapy? What is, cupping, right? And so that I could actually kind of be that bridge between medical intuition and these other various treatments and practitioners. And luckily for me also, I spent many years on my own healing journey. And so I like to, jokingly say that spirit gave me kind of a crash course in healing modalities because I was desperate to find a solution for myself. And I tried everything, so I went to, talk therapy. I went to acupuncture. I went to Ayurvedic. I did past life regressions. I did it all. And I did a lot of research, trying to figure out how to heal myself. and so that research kind of paid off when I started working as a medical intuitive. I was able to draw on that and then also to kind of continue that process of educating myself about what's out there and what might benefit my clients. And so it's kind of an ongoing learning process. But it's really exciting to be able to bring these together because I think that in the past there was a lot of suspicion, in more traditional forms of medicine. There was a lot of suspicion for, around intuitives, right?
Mm-hmm.
They really trust us. Like, what are we doing? That crazy woo-woo stuff. And I think that's changing. I've seen it change over the years. And so I'm really excited about kind of facilitating those connections. Yeah.
Yeah. Well, it is exciting to see the complementarity merging and more synergy. And maybe share a little bit about just your overall philosophy of how to approach somebody who presents an illness or a symptom. How are you sort of beginning to kind of like feel into that, work with that, and understand what might be behind that?
Yeah. So my particular form of medical intuition is, heavily informed by my training in indigenous forms of healing. And so I feel like I have a philosophy of healing that comes from Afro-Caribbean and Native American traditions. And so some of the kind of assumptions that we make are, that everyone is unique. And so we don't look at the person as a type of patient that has a type of condition, right?
Mm-hmm.
And that's kind of unique, I think, to indigenous practice where each person is unique. Each person is going to have to be assessed in a unique way and treated in a unique way. And so that's one thing. Another thing is that it's important to approach the person with a lot of respect and kind of care and compassion. Really love is what I was taught to approach my clients with. And so every client that comes to see me, I feel immense love for them. And I try to teach that to my students. And some people find that weird because, of course, other traditions don't teach that. They'll say, it's clinical, you're assessing, but they don't want you to get emotionally involved, right? But I've been trained. That's how I was taught. You have to be emotionally involved. You have to love them. And you don't love them because of who they are or anything about them. You just love them because they're there and they're sick.
Yeah. Does that extend to the actual conditions they present with as well?
Well, I mean, to a certain extent, you have to approach the body and the disease in a kind of loving way as well. Like you can't see it as a battle. So in
Uh-huh. So that
allopathic,
whole philosophy of like, yeah, doing battle with the disease really doesn't.
yeah. Instead, you see it as a collaborator. So, like one of the things I do is you have a telepathic communication with the body, and you ask the organ that's in disease or just imbalance, what's wrong? What do you need? What do you want your person to know? So you
Hmm.
create this dialogue, and so it's not this adversarial relationship between you as the healer and the disease, right? It's more of a conversation to find out, why is this presenting? There's always a reason, right? Why a disease
Hmm.
presents. There's a reason, there's a message. And so I see my role as a medical intuitive as being, kind of a messenger and a way shower. Like I'm helping the client to get the information they need so that they can take the steps that are best for them. I'm also helping them to get the information they need to advocate for themselves when they do go to a practitioner for a treatment.
Hmm. So I'd love to get a specific example or two. So you're actually like you go to the liver and you're really having a dialogue with the liver and sort of eliciting a sort of wisdom about what that issue might be bringing for the person. Maybe share, yeah, just how that might result in something really surprising coming forward.
Okay. I'm going to try to give an example. I don't know if it's going to be it might be a composite rather than one patient story. But I remember tuning into early on in my career, tuning into someone's liver. And at that time, I was still learning. So one of the things I do as a medical intuitive is I study like pathology textbooks, or I go online and Google pictures of diseased organs. And so what as a clairvoyant, I will see a picture of the organ. So I saw this organ, this liver, and it had all these little globules of fat on it. And I didn't know what that meant. And so then I went back then I used to look at anatomy books and pathology books, but now you can just Google. And I would just like Google, okay, a diseased liver with globules. What is that? And I found out that it's got a really obvious name. It's called fatty liver disease. And so when I tuned in and I got this picture, right, clairvoyantly of this fatty liver, and then maybe I Googled it or something and looked it up, and said, "Oh, I'm getting something that looks like fatty liver disease." Then I will ask the liver, okay, 4 questions. What's wrong? What do you need? Is there a message for what do you want? What do you need? What's wrong? And is there a message? And so I might ask the liver, what's wrong, and the liver and these organs have personalities. So they might. I remember this organ having an attitude like, "You can see what's wrong. Look at all the fat."
I'm
And
getting the picture of that movie Inside Out, where they have all the different colors, the different attitudes and emotions. Yeah.
yeah, it's kind of like that. Like I see the organs as like little cartoon characters with little faces. And also, if you have a little face on the organ, that's a way to get emotional information. So if the organ is angry, like, then that lets you know that anger is one of the emotional components of this condition, right? Or if it's irritation or frustration, or there's different emotions that'll come through in the little faces, but also in their personality. And so the irritation, right, that I hear from can't you see? Okay, so now we know irritation is a part of the cause of this condition, right? And then I'll say, okay, what do you need? I need more water, or I need a procedure to remove this, or I need, right? What do you want? I want my person to deal with their anger, right? Or I want them to stop being like irritated with everything in their life because they haven't dealt with the big things, right? And so they'll give you information like that, which I could then pass on to the client. And sometimes it's a physical thing, like I need vitamin K, or I need therapy, right? I need a therapeutic procedure, or I need, the client to change their diet, right? They can give me information, which I can then pass on. And then the person can decide if they're going to do those things, right?
That's really fascinating. It opens up a whole world of understanding. So you're really developing a real relationship with the whatever it is, the organs or the disease part of the body when you're doing this work.
Yes, yes. Yeah.
So how do, and then maybe, so there's some obvious questions you might ask in that dialogue, like how do you go deeper into the deeper layers of what might be behind a particular symptom or pattern?
Well, the way I work as a medical intuitive is I use all the clairs. And so I don't just rely on one vehicle. So if I'm tuning into someone, they give me a question or a symptom, and I tune into that. And there's different ways to tune into it. So I can clairvoyantly scan that region of the body until I see something. Like in that case, I then saw the fatty liver, right? But I can also clairaudiently listen for any information. And sometimes I'll just hear words or phrases that will lead me in a particular direction. I can also tune in clairsentiently, and that's where I'm kind of wrapping my aura over my client's aura, and then I'm pulling their symptoms into my body, and I'm also pulling the emotions in. And so when I do that, I can sometimes then examine my own body, like maybe if there's something in the abdomen, well, you can't see my abdomen, but let's say it's in the shoulder, I can then start kind of prodding my shoulder and doing some range of motion stuff. And it's not my shoulder, it's theirs because I've taken their symptoms in. And so while I'm doing that, I can say, oh, there's a range of motion issue because I might get to this point and I can't lift my arm anymore. Or I'll say, oh, this really hurts. And I'll point to where it hurts. And then the client will say, yeah, that's where it hurts. And so it allows me to kind of examine them without touching them and just by examining myself.
Now,
And
first of all, it sounds a little sketchy to pull the energy in and be working at what, because that seems like a lot of people don't want to do that. Maybe
oh
share,
yeah,
how do you do that in a way that sort of doesn't end up with, energy that's not your own that's
yeah,
lingering?
a lot of my students don't want to do it. And so when I teach that part, a lot of my students are like, I don't want to do that. So I say, you don't have to. There's lots of techniques. This is just one of them. You want to pass over this technique, you can pass over it. It does require that you prepare yourself energetically. And in fact, all medical intuition I teach that it all requires that. And that's also apart from my indigenous training, that you don't just go into a healing session without preparing yourself energetically and emotionally. So you have to cleanse the space. You have to set up sacred space. You have to have an altar. You have to, burn your herbs, play your music. You have to do your emotional inventory to make sure that you're ready and really capable of doing the work right now. Like you're not upset about anything. You have to make sure that you're physically okay. Like if I'm not doing well physically, I'm not going to want to bring in anyone else's symptoms into my body, right? So you have to do all that preparatory work. And when you bring someone's symptoms in, you bring them in. And then once you say what the problem is, the symptoms go away. And if they don't, then you have to do extra cleansing. But when you're done with that little exercise, you also, very, very clearly return the symptoms to your client. And some people, you can sometimes do some, very quick kind of energy cleansing without being too dramatic because clients don't want to see you throwing a bunch of stuff at them like ill. But like you can do some subtle, but you can really just do it in your mind. I'm returning everything to them. You're visualizing their aura going back to them. And then when they leave, you can do some additional, saging or cleansing of some type to make sure that you have given it all back. And that is one of the things you have to learn as a medical intuitive when you're developing. You have to learn to leave your client at the office, right? You can't go home and think about them. You can't go home and start studying, oh, what's wrong? You have to finish with the session in the session, and you have to mentally let it go.
Makes a lot of sense. Well, I'm kind of driving off my questions right now, but maybe what are some of the other dimensions of the practice of a more integrative medical intuition that you're really wanting to get across today?
Well, what I'm really excited about right now is using medical intuition specifically to help the client find practitioners, find diagnostics, and find treatments. And that's something that I do in my in my practice, but I haven't been able to teach it a lot because I've been focused a lot on teaching people just how to assess the client and pick up the causes. So medical intuition focuses largely on identifying causes, right? What's causing the symptoms? What are the physical causes, emotional, spiritual causes? But often clients don't just want to know the causes. They want to know, what are my next steps? What do I do now that I know? And so I'm really interested in using medical intuition for those next steps as well. And so one of the things that, that I do with medical intuition is I can, if somebody already has a diagnosis and they come to me, I can tune into the diagnosis and see, is this a complete diagnosis? Do they need more information? Is it an incorrect diagnosis? Um, and or if they have maybe they've gone for a treatment and it's not working, right? So I remember that I had this one guy, he came to me and he had some type of a back injury, and he had tried physical therapy and it hadn't worked. He'd been trying things for years. He had tried different medications and herbs, and now they were telling him he had to get surgery. And so he came to me as a last ditch effort to avoid surgery, right? And asked me, okay, why aren't the treatments working? And so that's another thing that medical intuition can do, is we can tune in. And in his case, what was going on was they had only diagnosed a back problem like in his upper back. And when I tuned in clairvoyantly and clairsentiently, I picked up an additional back problem in his cervical spine.
Hmm.
And I traced the origin of that to a shoulder injury. And then I picked up that it was from an impact. And so I shared all this with him, and he said, yeah, I had a car accident like 10 years ago. And I said, so your current doctors, they're only looking at the current condition, and they don't realize that it's actually related to this old injury that's related to this other injury. And that your
Hmm.
current issue is a tertiary symptom. It's not the primaries. There's a primary and a secondary, and you're dealing with the tertiary. And so that's why the treatments aren't working, because they're giving you physical therapy on the tertiary symptom, when you really should be getting physical therapy on like the cervical spine and the shoulder, right? And so, this is the kind of thing that can come up where you can help the client kind of get more information about what their treatment options are, or why the treatment's not working, or why the diagnosis doesn't really seem to explain everything that they're experiencing. And so that's the work that I'm really excited about training people to do in this next class,
Hmm.
because much of the focus of medical intuition training is on teaching people how to find causes.
Hmm. That sounds really exciting. Well, I think this is actually a good moment to lead into the experiential you wanted to guide us in, so to really give people a taste of how this might apply in their own life.
Yeah, so I want to do a little experiential where you can tune in to your own body. And as medical intuitives, we help other people by tuning into their bodies, but it's also good to teach people how to tune into their own bodies, right? And so I have a little exercise where I want you to, we're going to do a short meditation, and then I'm going to show you some symbols. And so what the exercise is for you to focus on a diagnosis you have, and then we're going to try to intuitively get a treatment. So the first thing I would like you to do is, if you have a notebook and a pen, to get it out. You don't have to have a notebook, but just to first think about one diagnosis you've had in your life. It could be at any point, could be a long time ago, could be recent, but something that you've actually received a diagnosis for. So I want you to think about that. And then we're just going to take a few moments to just kind of ground and kind of clear our minds. And so I'd like you to just kind of listen to the music and go within. And you might want to close your eyes and just take a few nice deep breaths. Just breathing in slowly and deeply. And just imagine that you have a little broom in your hand and you're just brushing away all the energetic dirt and debris of your day, just taking a moment to go within and feel that the top of your head, your crown, is tingling as you're connecting to a higher source. And just feel the energy from higher source coming down, filling your body. And you're just taking some nice deep breaths and just relaxing. Just relaxing and going within. And for this exercise, we're not going to be thinking about things. We're not going to have to figure anything out. You're just going to relax and tune in intuitively. You're just going to go with your hunches, with what feels right. And so now that you're all relaxed, grounded, and connected, we're ready for a short exercise. So I'd like you to open your eyes, and I want you to be thinking, just have the word for the diagnosis in your mind. And we're just tuning in to this diagnosis. And when you're ready, you can open your eyes and look at this short little selection of slides. You're going to be seeing some symbols, or you can just listen to the names of the symbols and visualize them. And each time you see a symbol, I just want you to tune into the symbol and see if you feel a connection between that symbol and your condition. Our first symbol is bottle. Just see if you feel any connection to bottle. If so, you can jot it down or just remember it. Next, we're tuning into leaf. See if there's any connection that you have to a leaf. Next, we're tuning into a stick. Just feel if there's a connection you have to a stick. Our next symbol is hands. See if you have any connection to hands. Our next symbol is thistle. Just feel into that. Our next symbol is smoke. Just quickly a yes or a no. Pillow. Do you have a connection to pillow? If so, jot it down. Plate. Do you have a connection to plate? Our next symbol is ohm. Do you have a connection to ohm for your condition? Our next symbol is elder. Just feel into that symbol and see if you have a connection. Our next symbol is mouth. Let's feel into that. Our next symbol is book. Do you connect to the book? And finally, our last symbol is wave. Now, if you connected to more than one symbol, take a moment to kind of rank them. Which symbol did you feel the strongest connection to? And if there was only one, that's good too. You only need one. So now each of these symbols that I gave you are symbols for different treatments. And I didn't want to give you the treatments because I didn't want you to think about it. I just wanted you to tune in. And so now I'm going to define the symbols for you. So bottle, if you felt a connection to bottle, bottle is a symbol for medication as a treatment for your condition. Our second symbol, leaf, is a symbol for an herbal remedy. Could be American herbalism, it could be Ayurveda, it could be traditional Chinese medicine, but an herbal remedy would be appropriate. Our next symbol, stick, is a symbol for a medical procedure. That may be the best treatment for this condition. If you felt that connection. If you were connected to hands, physical therapy might be appropriate, or some other type of therapy like speech therapy or physical therapy. If you felt a connection to thistle, then acupuncture might be a good treatment for your condition. If you connected to smoke, then you might benefit from cupping or moxa burning. These are both treatments that are found in traditional Chinese medicine. If you felt connected to pillow, you may benefit from some therapeutic massage for your condition. If you felt connected to the plate symbol, some dietary changes might be beneficial for your condition. If you felt connected to Om, then meditation might benefit you in terms of your condition. If you felt connected to the elder, then ceremony might be a good treatment for you. And there's so many kinds of ceremony, right? If you felt connected to the mouth, then talk therapy might be helpful for you. And there's lots of different types of talk therapy, psychotherapy, behavioral, cognitive behavioral therapy. If you felt connected to the book, then you might benefit from a past life regression or Akashic Records visit, where you get to look at past life influences on your condition. And finally, our last symbol was the wave, and that's a symbol for energy work. So you might benefit from Reiki or pranic or some other type of healing work. So let me know, Stephen, how did that go for you? Did any of the symbols speak to you?
Yeah, I mean, I don't have a major condition that I'm sort of working with, but
No.
except for more of like just a feeling of like some excess belly fat that would sort of it kind of feels like, oh, I could lose a little weight there, but it sort of feels like it was interesting that I was more like, oh, I wonder what because I was trying to look for the connections between all the symbols, and then I was like, oh, it was only once you went through them that I kind of made more sense, and so I had more of like the herbal remedies and the smoke, the moxibustion kind of stuff, which is yeah, it's interesting to think about like, oh, maybe I need to consider those. I haven't really gone in that direction. So yeah, so that's how did you so have you tested this out with various folks and you feel like this is kind of people generally have this intuitive connections with the symbols that you shared there?
Well, no, I mean, I just made up the symbols to make it into an easy exercise for us.
Gotcha.
But the way it would normally work in a session is I'll mention a treatment to a client and then ask them, how does that feel? What's your response to that? And I ask them to kind of just respond to it. Now, sometimes people respond to things with their brain, well, I don't know about acupuncture, right? They might have a certain attitude about a particular modality. And so the symbols are nice because it kind of bypasses that thinking and just
Uh-huh.
people to,
Gets out of the conceptual mind. So in general, the more symbolic parts of our mind seem to be more connected to this intuitive information,
yes.
it sounds like, yeah.
Yeah. And so it's easier for people to accept something symbolically, and kind of feel into it than, to have to kind of go through whatever their preconceptions are about a particular
Hmm.
event.
And then you said you're also assessing like, how does that feel? How do they resonate? Do you do like things like muscle testing? Like how else do you sort of refine those kind of core intuitions as you get closer in?
Well, as a medical intuitive, I'll get one of those treatments for them, right? Intuitively, it'll show up either clairvoyantly or clairsentiently or, clairaudiently. But then when I talk to them about it, I'm also now tuning into what I call resonance. And so when the person is speaking to me, there's kind of like a back channel that also plays behind what they're saying. And I'm also it's also kind of a form of clairsentience where I'm feeling what they're feeling while they're speaking. And I'm also kind of getting a back channel of maybe other thoughts.
Hmm.
And and so if I say to a person, well, how do you feel about herbs? I think that might be a good treatment for you. And they might have a certain response like, well, I don't know. I don't, they might have a response which is like maybe a no, but then I can tune in um, to this resonance to see, is this something that they're going to comply with? Like, are they going to actually do an herbal treatment? And sometimes I'll get no, this person is not going to do herbs, right? That's just not going to happen.
So
They have
even if it's good for them, they're just going to have some blockages.
right. And so then I have to come up with something else. And so that's also a part of the assessment is you don't just tell people what to do, you make suggestions, but then you're also tuning into them to see, is this really appropriate for them? Because for that person, herbs might be beneficial, but not appropriate because it's not something they're going to do.
Hmm. So we've talked a little bit more about like reading a client or like how do these things apply when you're just trying to navigate your own symptoms and sort of like get the information from your own medical intuition to inform how to navigate something you're facing.
Yeah. So everything that we do in medical intuition, we can do on ourselves, right? It's not just for other people. And so with this exercise, you know, I'm trying to kind of get you to think about, oh, how can I consider different treatments, right? By just tuning in intuitively instead of kind of researching them and just looking at the data. I mean, that's good. That's good too, right? To research things, but it's really helpful to be able to just tune into something. And so tuning into your body, like the exercise, like what I was saying earlier about when I talk to someone's organs, well, we can all talk to our own organs. And so if I have a condition like in my stomach, I can then, close my eyes, imagine that I can see my stomach and try to see an image of the stomach, see if I see anything unusual about it. Does it have a funny color? Does it have a strange shape? Um, I can see if I can look for a little cartoon character. I can look for a little emoji on my stomach to get a sense of what's the emotional component. Why is my stomach always upset? Is there an emotion associated with my stomach being upset? And I might see like, a little emoji of like the teeth clenching, right? And that might be, like frustration or and then I can just kind of think about that and thinking, what is it in my life that's frustrating me that's causing me to have stomach aches? And then I can start to kind of reflect on when the stomach aches come and is there something frustrating happening every time I have a stomach ache? Um, but I can also, tune into the stomach and kind of ask my stomach, what do you need? What do you want? Um, and I might hear an answer like, I need you to eat more often. You go for long periods of time without eating. And then I have stomach acid that builds up and that's why I get upset, or you need to eat, fewer of this and more of that. And so we can all do that. We can all kind of tune into our body. And it's, at first, if you're not used to it, you might feel like, oh, I'm making this up, but that's okay because if you get information and you test it out, you're going to find out whether or not it's helpful. And so you don't have to worry about, oh, did I make it up? It's like, well, my stomach said to eat more frequently. I'm going to try that and see if it helps. And then you'll see a result, right? And then that's how you'll know, oh, that was valuable information. It wasn't just me making up stuff, right?
Hmm. One of the things you brought up a few times I'd like to dive into a little bit more around clairsentience and claircognizance and maybe share a little bit more about how people can know the difference between those kind of modalities and work with them different ways.
Okay, so clairsentience is clear feeling. It's being able to feel um, the symptoms, physical symptoms, or the emotions of another person. And we can also, tune into our own body, but clairsentience is that gift. And then what was the other one you asked me about? There's so
Claircognizance,
clear
claircognizance.
cognizance is clear knowing. And clear knowing is when you just have a kind of very sudden knowing, like yes, no, true, false. And they're very different gifts because with claircognizance, you're just seeking that yes, no, true, false. And so, like with the symbols that we were looking at just now for treatments, I was asking you to tune in either clairsentient or claircognizantly. So if you were tuning in clairsentiently, you were tuning in to see what does it feel like when you focus on that symbol. Like when I focus on herb, I have a good feeling, and that tells me, oh, herbs might be good for me. So that's clairsentience. When you're going with like, what does it feel like emotionally, or how does it feel in your body, right? When you are tuning into something. Whereas claircognizance, it doesn't really correlate with any senses. Like it's not something you see or hear or feel. All the other clairs are associated with the five senses. They're psychic versions of the five senses. And claircognizance is different because it's not associated with a sense. And so with claircognizance, you're not seeing it or hearing it or feeling it. You just suddenly know. And so it's really just like an on-off switch. Yes, no, true, false. And so with claircognizance, when you're tuning in to something, you're just looking for yes, no. And so claircognizance is really helpful for scanning lists. Like let's say I had a list of possible treatments and they were written out, long, acupuncture, Ayurveda, surgery, pharmaceuticals. I had some long list. Claircognizantly, you could just scan through that list very quickly without even really reading it. And just you're looking for a yes, no. Like as you're scanning, you're going to get like a true or a false, like true. And one of those things in that list is going to get a true, or you're going to get false, 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 true. No, 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 yes. It's very quick. And that's another way to get information very quickly. And it's really helpful in medical intuition because we can do things like we can have lists of practitioners, we can have lists of modalities, we have lists of treatments, we can have lists of herbs if you're looking at herbal treatment. And you could very quickly scan through that list. Like for example, as a medical intuitive, I do this a lot. Let's say someone comes to me and they say, "Oh, I have a headache." And I want to know why I have a headache, and I'm trying to find the cause of their headache. Well, there are some common causes of headaches. And so if I have that list in my head, I can scan claircognizantly through that list first. Okay, common causes of headache are problems originating in the brain, problems originating in the eyes, problems originating in the ears. Um, and so I might just scan those three things first. Is it the head? Is it the brain, the ears, or the eyes? And I will quickly get like a yes on one of those if it is. But if it's none of those, I won't get any hit at all. And then I'll have to scan other things. Like I might have to scan the whole body to see what's the origin of the headache. But having kind of a list that you can very quickly claircognizantly scan can allow you to get information very quickly about something.
That's super helpful. So really, yeah, you kind of get more granular with going through a list like that. Great. Do you want to give any examples of how you've sort of all these different elements you've talked about today can come together to really sort of create a real breakthrough in a health protocol?
Yeah, so from beginning to end, the medical intuitive or the person assessing themselves can use all of these different methods of scanning. And so you can do a clairvoyant scan of your body or your client's body where you're just like acting like an MRI machine and moving your awareness down the body and looking for hot spots or, where's the problem? And then once you find a problem, you can kind of telescope in like a telephoto lens, zoom in and try to get more information visually, clairvoyantly. You can then start this conversation with the organ, right? The telepathy with the organ and ask questions. You can clairsentiently pull the person's symptoms into your body and then examine yourself and then say that aloud so the person can confirm it or respond to what you're saying. And then you can, after you've identified causes, physical causes, you can then also tune into the aura and get emotional causes. So you can get emotional causes from the body itself, from that little emoji, or from tuning into your client and feeling their emotions as you are talking. And then you can get You can also get information about the spiritual causes of their condition, and that involves another process where you go to the Akashic records. But once you have all that information, you can then present it to the client and then also begin to ask, okay, treatment, I need a treatment, right? Or I need a modality, or where should this person go to next? And you can then ask the body, what's a good fit for them. Should they go to, and you can then clairaudiently hear like neurologist, oncologist, herbalist, Chinese medicine, right? And and then you can suggest that to the client, and then you can see what their reaction is to that, and then intuitively respond to that reaction and maybe suggest something else. You can also use your intuition to suggest types of practitioners, or even you might pick up a treatment, which legally, medical intuitives cannot diagnose or treat. And so when we get a treatment or a diagnosis, we don't give it as a definitive thing. We say, hey, this is what I'm picking up on. Please go to your healthcare provider and get a test for this. And so I might say to a person, I'm seeing a growth in your uterus. The test that would reveal this to be the case is an ultrasound. And so I might then suggest to the client, go to your doctor and ask for this test. And then they can get some, evidence for what I've picked up. Because the medical intuitive, we're presenting intuitive information, but we're encouraging our client to also work with a doctor or a practitioner who is doing work based on evidence, right? And it's the combination of intuition and evidence which really provides the complete assessment and treatment for the client. And so the medical intuitive can help with every step of that process. We can help them ask for a test. We can help them, lead them in the right direction to advocate for themselves. We can tell them what kind of practitioner they might want to go see next, what kind of questions they might want to ask. And we can also suggest treatments that might lead them to a certain modality. And now, once they get to that practitioner is going to be the one to decide, how to treat them. But what we're doing is we're kind of arming the client with information that they can use to advocate for themselves. And so medical intuition, it just provides a lot of different kind of tools and information for the client, which they can take or leave and which they can then use, on their healing journey.
Well, Dr. Vest, it's really clear just how much mastery and depth of wisdom you have in this area, and it's fascinating to hear how you go about the whole process. So I want to spend some time now talking about the groundbreaking course that we mentioned earlier, which is an amazing opportunity for people to learn from you and really be able to apply this in their own lives. So Dr. Vest is going to be teaching his brand new course for Shift. It's called Integrative Medical Intuition for Accelerated Healing. Use advanced intuitive skills to support diagnosis, treatment decisions, and care navigation. You can find it at the URL integrativemedicalintuition.com, integrativemedicalintuition.com. This is a 7-week program, and Dr. Vest, I'd love for you to share some of your intentions for what people will come away with, and then let's give a tour of the modules you'll be teaching.
So my intention with this course was to provide kind of additional information about how medical intuition can be used as integrative medicine, like how we can take this, the tools of medical intuition and use them to help the client kind of combine them with other forms of medicine, kind of helping clients, move towards their next steps and figure out, what to do next in terms of, diagnosis, treatment, and practitioners. And, I'm teaching people in this class different techniques to scan for different types of information to give to the client to help them kind of in their journey moving forward from assessment to treatment to practitioner, et cetera.
Great. So Module 1 is all about embrace medical intuition as integrative medicine to identify physical and emotional causes of illness.
Yeah, so in this module, I'm kind of giving an overview on how medical intuition is integrative medicine. It's not just alternative medicine. It's not just something that exists in some other world, but how it can all work together with other forms of medicine. And then we go over just how the VEST protocol is a systematic approach, how it uses these different clairs to scan, and how we can scan modalities claircognizantly. Instead of just assessing causes of illness, I'm teaching people in this class, how do we scan for modalities? How do we also explore, our own assumptions about how medical intuition should be used? How do we create a plan as medical intuitives on how to expand our knowledge of different healing modalities and healthcare specialties so that we can learn to do this work in a more integrative way?
Module 2, listen to the body to assess the organ and ask the body for guidance on next steps.
One of the things that I'm teaching is that telepathic conversation with an organ, how to have that conversation and how to listen to your client, how to, when you're assessing a client, also listen to them, listen to those back channels, use resonance to find out what the client really needs. And then in this module, I also talk about how important diagnosis is for recovery. A lot of people that come to medical intuitives come because they've gone to doctors and they haven't gotten a diagnosis. And a lot of people have a hard time moving forward without that. And so we talk about that.
Module 3, combine medical intuition and mainstream protocols so you can work with any healthcare practitioner.
So in this module, I talk about different kind of philosophies of healing. So we talk about indigenous healing philosophies, and then some of the philosophies that are undergirding other traditions. And then there's 3 traditions that I focus on in this course. I look at allopathy, like what we think of as mainstream medicine, Ayurvedic, which is an ancient Indian form of medicine, and then traditional Chinese medicine. And they all have different kind of philosophies about how we approach healing. And so in this module, we're talking about these different approaches. And at the same time, I'm also teaching people how to do claircognizant scanning, looking specifically at Ayurvedic, allopathic, and traditional Chinese medicine kind of codes for diagnostics.
Module 4, intuitive diagnostic assessment techniques to facilitate your client's transition to a follow-up healthcare provider.
Okay, so in this module, we're looking at how can we use claircognizance and clairvoyance to scan a list of diagnostic tests. So there are a lot of diagnostic tests out there that are already being used, right, in different forms of medicine. And we can scan those and kind of make suggestions to the client about what kind of follow-up tests could be made. And then we can also communicate clairaudiently with the body about those tests to see, is there a match? In this module, I also am teaching people about documentation methods so that you can share what you're picking up with whatever practitioner your client goes to next.
Module 5, medical intuition techniques for identifying treatment options.
We're learning how to scan the emotional and physical aura layers and how to use claircognizance and clairsentience to do the scanning of lists. And we're going through treatments, scanning treatment lists, doing active listening with your client to find out which treatments are going to be a good match for them. In this module, we're also talking about trauma and emotional injuries and how they can impact compliance with a particular treatment. And so the student learns in this class, in this module, how to use clairaudience and resonance as well to assess the best treatment.
Module 6, evidence-based research tools to amplify and complement your intuition.
I'm really focused on introducing the student to evidence-based medicine. I firmly believe that intuition and evidence should work together, that empirical data and intuitive data should work together. And so in this module, we're talking about, how can the healer or the medical intuitive learn how to research evidence-based medicine and then inform our treatment suggestions by that. So if I tell a client, hey, I think you should consider this red light therapy that I just picked up intuitively, it's helpful if I've gone and looked up red light therapy and found that there are medical studies showing that it's efficacious for a particular condition. And then I can share that with the client. And so in this module, I'll be teaching people how to get that information and how to bring that information into your practice.
Super helpful. Module 7 then is combine all types of scan information to provide comprehensive care for your client.
So one of the things we're going to be doing in this module, of course, we're going to be bringing everything together in this last module. But another practice that we're going to be focusing on is learning how to actually tune into practitioners. And so sometimes a client has been referred to a specialist, or there's a couple of options for them to go see a specialist. In this module, I'm going to teach you how to tune into the name of that specialist to see if it's a match for that person, or to pick up other information about that practitioner. And we're also going to be talking about summary protocols, how the medical intuitive can kind of summarize things to give to their client so that they can take that to their next practitioner. And also just how to help the medical intuitive to have more confidence in how to help their client, what's the best way to help them, and which gifts to use for which clients so that they walk away with exactly what they need.
Well, it's a very comprehensive and very sophisticated offering that you've created here that's going to be so beneficial for people in their personal lives and for working with clients, whatever form they do. So again, it's all at integrativemedicalintuition.com. I'll share a few other things about the program. So you get the 7 90-minute live sessions with Dr. Vest, which are going to include a lot of practices, exercises, time to ask your questions live. You also get recordings for every session, both video and audio, as well as word-for-word transcripts to work with, study, and highlight. There are weekly exercises and practices for home. There's a community group to support you and deepen your experience, as well as small group time to connect with other participants. I also just really want to emphasize the power of live learning. It's one of the things that really makes the Shift Network different from so many other offerings out there. This is not just watching pre-recorded content. You're engaging in a living field of inquiry with participants from around the world, and you're also asking questions live. So it's a really deeper form, both practically and energetically, of working with this material. And so, and on the page, I also want to draw your attention to a number of extra bonuses that Dr. Vest has been very generous in adding. There's an excerpt from The Ethical Psychic called How to Become an Ethical Psychic. You want to share more about that excerpt?
Yeah, so this is my book, The Ethical Psychic, and it's one of the chapters in the book where I give some kind of clear guidelines on things to focus on if you want to make sure that your practice as a healer or a psychic is an ethical practice.
Great. That's one bonus. And there's a second bonus, which is a full video teaching that goes much more in depth into how I became a medical intuitive. I mentioned there's a lot of cool stories in there too. So, Dr. Vest, you want to share more about that?
Yeah, a lot of my students ask me this question. Like, I don't tend to talk a lot about my biography in my classes, but it's a question that a lot of people have. Like, how did you get to this point? And I realized that, when I was developing my gifts, I found it really beneficial to read biographies by other psychics and mediums and healers, because then I could kind of see my own journey in theirs. And so I decided to, have a whole interview where I tell all the stories of how I got on this path, because it might really resonate with other people who are on a similar path.
I'm sure that's a fascinating bonus. And then we have one final bonus you get if you sign up by midnight tonight Pacific time. This is our way to really encourage you to take the time now at integrativemedicalintuition.com. Tune in with your own inner knowing. And if you choose to move forward today, you're going to get a video dialogue with Dr. Vest and Dr. John Ryan as all medical intuition and the new quantum process. Want to share more about that special bonus that's folks get today?
Yeah, that was really interesting. We had this dialogue. So, Dr. John, he has an interesting background. He is a doctor, an MD, right, an allopath, and his area is diagnostics, but he's also an energy worker. And so we had a really interesting conversation about diagnostics, how it works in Western medicine versus how diagnostics works in medical intuition. And then we also talked about energy.
Cool. Well, great. That's a great extra reason to sign up right away. Well, it's going to be such a powerful program. We know Dr. Vest is truly a master of this whole realm, and so you're getting to learn from the best. And we've kept the investment very accessible. It's just three payments of $128. You save 10% when you pay in full with one payment of $349. The course is going to start June 25th and run Thursdays at 1 Pacific, 4 Eastern. But even if you can't make the live times, you can still get the full value with the recordings, the transcripts, and the community as well. There's some great testimonials on the page from participants in previous courses from Dr. Vess. Incredibly honorable, wise, and gifted teacher. Amazing, most compassionate, humble, ethical, and excellent teacher I've had the privilege to learn from. So really raving testimonials about her as a teacher and mentor and really a pioneer in this field. So you are in very good hands, and I'm sure you're coming away with some very deep new skills that really benefit your life and those around you. So again, it's all at integrativemedicalintuition.com, and you'll get that special bonus with Dr. Vess and Dr. Ryan on medical intuition and the new quantum process if you sign up by midnight tonight. So Dr. Vest, always so illuminating to be with you. Anything that's still on your heart you want to share with folks who are considering doing the course with you?
Yeah, just if you're the type of healer who's really interested in working with other healers, with making sure that the work that you do is really relevant to what's happening right now, what your clients are really interested in right now, this would be a good course for you.
Awesome. Well, thank you for the depth of wisdom and expertise and heart that you bring to this work. And thank you all for joining, and look forward to seeing many of you in Dr. Vest's upcoming course. And again, the URL is integrativemedicalintuition.com, and the course is Integrative Medical Intuition for Accelerated Healing. Use advanced intuitive skills to support diagnosis, treatment decisions, and care navigation. So thank you so much.
Thank you.